to leave the EU, and my opinion hasn't changed. Our NHS was created long before the EU and will be here long after we leave. Are there risks? Yes, but no one really expects that these risks won't be addressed in a future deal. We are leaving the EU, not Europe. Our continuing cooperation with European nations will continue, and I expect some will be strengthened. I agree that we have to ensure that medicines, equipment and staff should be free of restrictions wherever possible. People are predicting that Brexit will lead to the collapse of our NHS because we will lose doctors and nurses. But let's not forget that just over 2% of NHS staff come from EU countries, and just over 5% of our doctors and nurses come from the European Union. The vast majority of our foreign-trained doctors come from the Indian subcontinent, followed by Egypt and Iraq. Cabinet Secretary, what discussions have you had with the UK Government about making it easier to recruit non-EU foreign-trained doctors and nurses following Brexit? And Cabinet Secretary, have you considered the risks to the future of health and social care in Wales of the UK remaining in the EU? After all, it had been up to EU negotiators. Our NHS would be at the mercy of large American corporations as a result of TTIP. We need to be looking outward and not inward as we go forward. We live in an age where collaboration is taking place on a global scale. Science doesn't see borders, and if we are to tackle big challenges to our health and well-being, we have to cooperate on a global scale. The EU alone won't tackle antimicrobial resistance. The EU alone won't combat cancer, heart disease or the obesity crisis. We have to work closer with all nations, EU and non-EU countries, to face these challenges. So, Cabinet Secretary, do you truly believe that it's in the EU's best interest to isolate the UK in the way you highlight in your statements? Although we have different opinions on Brexit, we do need to work together to ensure that our NHS and social care sector do not suffer as a result of Brexit. I don't believe they will, unless the EU takes a political decision to punish the UK. So it is in all our interest to ensure that this doesn't happen. Thank you.
Thank you. Cabinet Secretary.
Well, thank you for the comments. I'm not surprised that you haven't changed your mind on leaving the European Union. But I would have thought there would be a dose of reality again on what that actually means if we leave with a no deal or a hard Brexit. And in terms of, look, the workforce for the health service outside of the European Union, we've had long and spirited correspondence and conversations between officials with the United Kingdom government and indeed every organisation representing health and care staff right across the UK has called on the UK government for a long time to change the environment and to change the rules around people being recruited into our health service. So I welcome the U-turn announced by Sajid Javid to lift the Tier 2 restrictions. That was a positive step forward. And that was always within the gift of the United Kingdom. It was the madness of having the Home Office say to the health service, you can't restrict the staff that you need, who you could recruit to meet our health and care needs, because we put an artificial cap on the numbers that can come in. So that's nothing to do with the European Union. And I just think in terms of your suggestion that this is about the European Union punishing the United Kingdom, this basically comes down to if you leave a club and you say, I don't want to play with the rules, but I want all the benefits, but I'll then decide what else I want to do as well, then that is absolutely where we can't be. We have to have a range of measures that deal with the reality of European Union-wide institutions and rules. And if we want to benefit from those, then we will need to act in a way that is consistent and have agreement about doing so. And your point at the start of your speech saying nobody wants medicines and equipment to have any restrictions. Of course we want to be free of restrictions, but that requires us to have systems that allow us to do so. And so that is why arrangements around customs and trade do matter. 47 million pharmaceutical products each year go into the European Union and about 39 million come back the other way. There's huge trade going on here between ourselves and the rest of Europe. So the customs arrangements and trade really do matter in this area of activity too. But they're underpinned by EU-wide systems in terms of how medicines and how equipment come into use within Europe. And there's a common sense point here. We either want that to continue or we're prepared to wear restrictions that will cause real harm to people in our country. My view is we should not countenance that possibility. We should not wish to say it is acceptable to have the average 6-month delay for new medicines to become available, as is directly the case now in Switzerland. I do not believe that be acceptable. The Welsh Government does not believe that be acceptable either.
Thank you, Deputy Presiding Officer, and can I thank you, Cabinet Secretary, for this